Not all Medicare Advantage plans are created equal, and today we're going to rank them from best to worst. Now, what do I mean by this? My best may not be what's best for you, but we're going to teach you to look at a couple key criteria on how to decide which would be the better plans for you versus the worst. Hi, I'm Erika Smiley, and today we're just going to review all about Advantage plans, the different types of Advantage plans. We'll talk a little bit about star ratings and how you can rank yourself what's going to be the best plan for you versus ones that aren't going to fit so well. So let's start by looking at the different kinds. There are actually two kinds of Advantage plans overall. There's what we call an MAPD. So this is a Medicare Advantage plan with prescription drug coverage. And so that's going to give you that Part D drug coverage included in the Advantage plan. Then we have MA only plans. So these are Medicare Advantage only plans. So this does not have drug coverage included. And this is really only going to be a fit for people who have VA benefits or perhaps TRICARE, you're retired military, or possibly you're an FEHB, a person who has the retired from the federal government. So these people can actually get their medications through those programs, so they don't need that portion of it. All they need is the Advantage plan doctor coverage, right? The medical coverage. They don't need the prescription coverage. So they get an MA only plan. And these plans actually have a Part B give back quite often because these people don't need the drug coverage. So they're going to give them some money back towards their Part B premium. Now, really today, because most of you are probably not VA or TRICARE or FEHB, I'm just going to talk in general about the MAPD plans today that most of you have that have the drug coverage included. All right, so now that we know we're focusing on these MAPDs, let's look at the different types of Advantage plans. So this illustration can kind of show the restrictions of the three different kinds of plans. So first of all, we have HMO plans. So the HMO plans are going to be the most restrictive because you have to stay in network. So you see there's this box here. You cannot go out of network with an HMO plan, or you're going to have to cover your own costs. It's not going to pay if you're out of network. Then we have the PPO plans, which are going to give you more freedom. You can go in or out of network. Now, of course, you're going to save more money if you stay in network versus out of network. But they're going to give you the most flexibility and freedom when it comes to the doctors and the providers that you're going to see. And then somewhere in the middle of this system, we have what's called a HMO POS. And it takes kind of traits from each of the plans and brings them together. The HMO POS stands for point of service, and this is where you can go out of network and see doctors. You just may need a referral from your primary care physician to do that. So we'll talk a little bit more in depth about each of these plans. All right, so let's look at some characteristics of these different types of Advantage plans. So first of all, we have PPO plans, which stand for Preferred Provider Organization. So these plans are going to give you the most freedom and flexibility in who you can go see as far as getting care. So you can go to out-of-network doctors, you can go to out-of-network specialists. You're just going to probably pay a higher copay if you go out-of-network opposed to staying in network, okay? Now with these PPO plans, you will see they probably have a little bit higher copays and definitely a higher max out of pocket usually than the other types of plans. So the PPO out of pockets can range anywhere from $5,000 a year all the way up to maybe $9,000 or $10,000 a year. If you go out of network, I've seen them as high as over $11,000 a year. And remember, that max out of pocket means if you had a really bad year medically and you maxed out your plan, how much are you actually having to pay out of pocket, okay? So even though you have a lot of freedom and flexibility with these plans, you might pay a little bit more if you have a lot of health issues. And another thing we're seeing with the PPOs, this is just a trend for 2026. A lot of these PPO plans are going away. So insurance companies are not seeing them as profitable, and they're going more towards HMO and HMO POS models. So in 2026, we're seeing a lot fewer PPO plan offerings than we have in the past, okay? All right, let's move on to HMOs. So HMO stands for Health Maintenance Organization, and these are more restrictive plans. So if you remember my picture, these are the ones in the solid box where you can't go out of network. If you stay in network, you can significantly probably save some money, but if you go out of network, they're not going to cover it at all. You're going to be 100% responsible. So again, lower cost. That max out of pocket on some of these HMO plans, I've seen them as low as like $1,900 up to like maybe $3,000 or $4,000. So usually those max out of pockets on the HMOs are a lot lower than with the PPOs. Again, though, you are going to have a limited network. So that doesn't mean you're not going to have doctors to choose from. You will have doctors to choose from. But if you've seen the same doctor for 25 years and you love Dr. Smith and you're rigid with that and you don't want to switch, this may be a limitation of an HMO plan. If you're more open to seeing, whatever doctor, there's going to be options for you. So just keep in mind that HMO is the most restrictive. You can't go out of network. Now let's talk about this third type of plan, which is gaining popularity here recently, and that is the HMO POS. And POS stands for point of service. And what this is, it's a hybrid between the two types of plans. So you can go out of network, but you have to have a primary care physician. So you have your assigned primary care physician, and they have to give you a referral to go out of network, okay? Now this is kind of nice. With an HMO, even if you're in network, you will oftentimes have to get a referral to go to a specialist. With an HMO POS, a lot of times they do not require a referral if you need to go to a specialist in network. So that works a little bit more like a PPO. But if you do want to go outside of the network, you do have to get a referral from your primary care physician. But I have heard in some of these plans, you don't even pay significantly more if you go out of network. They still charge you kind of in-network prices. And the max out of pocket on this one is probably going to fall somewhere in between the HMOs and the PPOs. If you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. All right, so what are some other criteria we can look at when we're kind of rating an Advantage plan? First, we have the different kinds of Advantage plans, PPO, HMO, HMO, POS. We also have the star ratings. So the star ratings are put out each fall by CMS. And what they do is they rank these plans from anywhere between 1 to 5 stars, 1 being the lowest and 4 being the highest rating. Now for these MAPD plans, there can be up to 40 different metrics or measures that they actually look at. But they fall under these main categories. The first one are member experience surveys. So they're actually sending surveys out to the members or the beneficiaries of these plans to ask how happy they are. Then they're also looking at some clinical outcome and data. And then lastly, they're just kind of looking at customer service. So how many appeals were there? How many complaints were there? Operational and customer service things. And that's how they come up with the star rating for the plan. All right, so let's get into ranking some of these plans. And here's the criteria we're going to kind of use. So what's the network sizes, or mainly the accessibility, right? How much access do you have to different doctors? Then we'll kind of look at the cost sharing, the premiums, like the prices and copays and max out of pocket that you're going to pay. We'll talk about the ease of use, the flexibility of these plans, and lastly, the star rating. All right, so let's look at how we would kind of rank the plans if we're looking at access to care and flexibility in what doctors you could see. Well, first choice, I would choose a PPO plan, because with the PPO plan, remember, you can go out of network. You don't usually have to have a referral to see a specialist, so you have more access to care and more providers to choose from. So that would be my first pick with the PPO. As far as flexibility and access to care, for my second choice, I would go with that HMO POS. So again, remember, this is a hybrid of both systems where, yes, you have to have that primary care provider refer you to someone outside of network, but you can see someone outside of network. So you might not have total flexibility like you do with a PPO because you have to get those referrals, but it's still going to give you access to doctors that are outside of your network. Now, third choice, if we're looking at access to care and flexibility, would be the HMO, because it is the most restrictive, where you have to stay in network. You cannot go out of network, and if you do, you're going to have that cost 100% on you, because they're not going to pay anything if you go out of network. Now, this doesn't mean if you have an HMO plan right now, it's awful and you have no care. It just means If you've seen Dr. Smith for 30 years and you want to keep going to see Dr. Smith and you get put on an HMO plan, you better make sure Dr. Smith is in that HMO or you're not going to be able to see him. But again, you'll still have plenty of options to choose from. You just need to make sure you stay in network. So it's going to be the most restrictive when it comes to your flexibility and freedom of what providers you can see. Now let's kind of flip this and rank the plans on how I would rank them if you're looking to save money. So actually it would be reversed. I would have the HMO in the first position because the HMO, even though it has a limited network, because you're staying in that limited restrictive network, you're usually going to save some money. So your copays or your out-of-pocket costs may be lower, and your max out-of-pocket may be lower. So if you remember, I've seen some max out-of-pockets as low as $1,900 on these. Usually they're around $3,000 to $4,000, and that's the most you would pay out-of-pocket if you have a bad year medically and max out your plan. So I'd choose that HMO all day, number one, if you're looking to stay in a tight budget and you don't mind staying in network. Number two, as far as cost savings, I would go with the HMO POS system because it's probably going to fall somewhere right in between the HMO and the PPO. So you're probably going to have a lower, again, probably that $3,000 to $5,000 max out of pocket. You're going to have lower copays than you might have if you're out of network with a PPO. So that would be my second choice if we're looking at saving money. And the PPO would actually be in my last spot when it comes to cost savings because even though you have a lot of access to care and freedom and flexibility of what doctors you want to go to, it's going to have a higher max out of pocket. So usually on these plans, we see max out of pockets anywhere from $5,000 all the way up to $11,000. I've seen over $11,000 if you're out of network. So you got to keep in mind, you're getting more freedom and flexibility, but there's a cost for that. So if I was looking at cost savings, HMO would be number one, HMO POS number two, and PPO would be in the number three position. Now, I think the most important thing to remember is these plans need to be very customized to you. So when you talk with somebody, whoever you work with, and you can always call us, schedule an appointment with one of our guides. We're always going to ask you who your doctors are, who your specialists are, what hospitals would you go to. Then we're going to plug in all of your medications because, again, an Advantage plan is not as good as the paper it's written on if it doesn't have your providers and your medications covered. So you want to make sure you really know how these plans work. Ask about the max out of pocket and what that is. They're all going to have benefits, right? They're all going to have dental, vision, and hearing and some perks. They're all going to give you drug coverage, but it's really finding the one that's going to be the best fit for you. Now, a lot of you may choose not to go the Advantage route at all. You may decide you want a supplemental plan. If you want to learn more about the differences, check out this video.